1.5 to 2 inches. The fingers may be interlocked to keep them off the chest. With your shoulders directly over the chest, press straight down. Compressions should be regular and smooth, half compression, half relaxation. A common error is the rocking chair technique, where compressions are done from the side instead of straight down. The arms should be kept straight, with the elbows locked. Bending the elbows soon tires the arm muscles. The natural weight of your body should be doing the work. Keep the heel of the hand on the sternum at all times. Compress and release in a steady rhythm. Bouncing compressions are less effective and are more likely to cause internal injuries. Keep your fingers off the chest. Use the heel of the hand only. Massaging or pressing on the chest with the fingers may cause rib injury. Another hand error is the crossed hand technique, which makes it difficult to keep the correct position and pressure on the sternum.
And when to use it. When someone's heart stops beating, it's called cardiac arrest. CPR is needed right away when this happens. Cardiac arrest victims will die if they don't get help fast. When cardiac arrest strikes, the victim typically collapses, stops breathing, or stops breathing normally and can't respond.
Sir.
If the victim does not respond, and the victim is not breathing or not breathing normally, yell for someone to call 911 and have them get an AED. An AED is a portable electronic device that helps the heart return to its normal rhythm. If you're alone, call 911 and get the AED yourself. Then follow the AED's voice prompts. If no AED is available, immediately start CPR, beginning with compressions. Doing CPR is not hard. Anyone can do it. And now the American Heart Association is making CPR easier than ever. We used to tell people that the proper steps for CPR are airway, breathing, compressions, or ABC. But we've changed that order, so the compressions come first. It's now compressions, airway, breathing, or CAB. This new order makes it easier because anybody can start out with compressions, even with no CPR training. Just push hard and fast on the center of the chest. If you haven't been trained, keep pushing until help arrives. When you give compressions, make sure you push the chest down at least 2 inches and allow a little time for the chest to come back up. Push as hard and fast as you can. The perfect rate for compressions is at least 100 per minute. That's the same speed as the beat of the song Stayin' Alive, so try to keep that tune in your head if it helps. If you've been trained in CPR, push on the chest 30 times, then open the airway by tilting the head back and lifting the chin. This helps air reach the lungs. Next, give 2 mouth-to-mouth breaths over 1 second for each breath, and watch for the chest to rise. Continue the CAB cycle until help or an AED arrives. Use the same CAB cycle for adults, children, and infants. This is just a quick overview. So to learn more or to sign up for CPR training that can help you save someone's life, visit our website at www.heart.org/CPR.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest. Then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push at a rate of at least 100 beats per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR, but if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, call 877-AHA-4CPR or visit heart.org/hands-only-CPR.
2, 3, 4, 5, 6, 7.
When another
8,
rescuer is
9,
available
10,
to assist
11,
with CPR
12,
at the scene,
13,
the second
14,
rescuer
15,
should activate the
16,
emergency
17,
response
18,
system
19,
if he or she is not
21,
EMS
22,
and get
24,
an AED.
25, 26,
Help is on the way.
28, 29, 30.
In two-rescuer CPR, each rescuer has specific roles. The first rescuer performs chest compressions and counts out loud. The second rescuer maintains the open airway and gives breaths. The compression rate for two-rescuer CPR is approximately 100 compressions per minute. The compression-ventilation ratio is 30:2. Compression should be paused when giving ventilations until an advanced airway is in place. When performing CPR without an AED, rescuers should switch roles every 2 minutes to prevent fatigue. This switch should take less than 5 seconds, minimizing hands-off time. Rescuers also need to assess the rescue effort. The person ventilating the victim must observe the chest compressions that are delivered, encourage the compressing rescuer to push at an adequate rate and depth, and ensure that full chest recoil occurs after each compression.
Step 1. Check for responsiveness. Tap and shout, "Are you all right?" and scan the chest for movement. Step number 2. Activate the emergency response system and get an AED. Step 3. Circulation. Check the carotid pulse. Do not spend more than 10 seconds checking for a pulse. If you find a pulse, support the patient with rescue breaths. If you can't feel a pulse within 10 seconds, initiate CPR. Immediately give 30 chest compressions, followed by 2 breaths. Okay, step number 4, defibrillation. As soon as possible, connect an AED or defibrillator, and if indicated, deliver a shock. Let's take a look at how the BLS steps come together in an arrest situation with an unconscious patient. Here's our case scenario. A 57-year-old man is experiencing many of the warning signs of acute coronary syndromes, with chest discomfort, indigestion, and feeling faint. He collapses and falls to the floor.
Sir? Sir, can you hear me?
Look or scan the chest for movement.
He's unresponsive. Call a code and get the AED and crash cart now. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3.
The code team is on the way.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Apply pads to patient's bare chest.
25, 26, 27, 28, 29.
Plug in pads connector.
One.
Analyzing heart
Okay,
rhythm.
stand back.
Stay clear of patient.
7, 8.
Shock advised. Charging. Stay
I'm ready
clear
to
of
shock.
patient.
I'm clear,
Deliver
you're
shock
clear,
now.
we're all clear.
Press the shock button now. Begin with compressions.
1, 2, 3.